Aloha, everyone. Statewide, there are 4 new positive test results for Hawaii. 3 of those were on Oahu, and one was a resident diagnosed out of state. That individual got sick out of state and was part of a cluster in another state. We count those toward the cases in Hawaii, just as we would someone who's on a cruise ship or somewhere else. If they're a Hawaii resident, they get counted in Hawaii. With these new cases, there is a cumulative total of 613 positive test results since the end of February when this outbreak started. Of these cases, a total of 516 individuals have been released from isolation. To date, there have been nearly 30,000 laboratory tests conducted for Hawaii, and 2.1% of these tests have had positive results, much lower than virtually every other state that's doing this type of testing. The testing rates in Hawaii remain high, and my staff is working on a comprehensive plan for surveillance testing in our state as we move into recovery and the next phase of this pandemic. An enhanced Sentinel surveillance plan for the state will be a focal point for testing, identifying and monitoring the potential spread of COVID-19 as the state reopens its businesses, schools, and community activities. This plan will involve the medical community, private physicians, and clinics, schools, businesses, community health centers, and clinical laboratories. Strengthening our department's contact tracing capacity will also be key in implementing effective disease containment and control measures. As the governor mentioned, the department is using technology to help streamline the process of contacting positive cases and conducting investigations. We have begun incorporating the use of a new digital tool called Health Space to follow up with individuals who have close contact with a positive case. Close contacts will be able to use the application to provide information on their health status and to transmit the information securely to the Department of Health. The information is encrypted to protect the privacy of the individual. We'll be providing more information on this very soon. As you know, contacting individuals and tracing cases is intensive and time-consuming work. This new application has been used successfully in other states, and we're looking forward to incorporating it for use here in Hawaii. There's been a lot of talk about the Abbott rapid testing equipment, and I'm pleased to report that the Department of Health has completed training for using this test and distribution of the rapid test kits and supplies to the counties. Equipment has been received on all the neighbor islands at labs and hospitals, and I understand the Abbott rapid test has already been used on Maui to test a hospitalized patient who was being moved to hospice. This is a perfect application for a test kit that's rapid. The equipment enabled the hospital to quickly confirm the patient was negative before moving the individual to another facility, which protects both the patient and the healthcare workers. Another critical component required for reopening the state is the establishment of isolation and quarantine facilities on every island to ensure individuals who do not have a location or to stay in or to isolate in will have options to protect their family and their community. We've identified and secured private sites on Oahu, Maui, Kauai, and the Big Island, and county sites are also established for Kauai and Oahu. This was a collaborative effort between the counties and the State Health Department, and I'm very pleased that we have options for those who are living in situations where they may not be able to isolate themselves. I should also mention that we have sites on Molokai and on Lanai as well. That concludes my report.